Well, it's the difference between life and death sometimes.
Many supporting those with mental health and addictions issues say they're eagerly awaiting a launch of a new provincial program that will serve as a one-stop shop for intake when it comes to mental health and addiction services, saying access has long been an issue in the province that has cost people their lives.
I think it's really important that they get the information out there as soon as possible, right? Because somebody dies every single day here in Manitoba.
Manitoba Mental Health and Addictions Connect will bring a new self-referral web portal and a provincial toll-free phone number that Manitobans can use to request intake for mental health and addiction services. Mom Stop the Harm member Arlene Lass-Kolb lost her son to an overdose in 2014. She says the new model is a positive as it aims to standardize the intake process as opposed to having people being asked to complete intake and assessments at several agencies before being matched to an appropriate service.
Too many people like myself, like my family in this area, have lost loved ones because they did not have access. They did not have the help.
Addictions are rampant in downtown Winnipeg.
The Lighthouse Mission on Main Street is set to bring 10 detox beds online in 2026, and leadership there says the combination of the two streams into one will help.
We have a lot of folks that are struggling both in mental health issues, they're struggling in addiction, and it's hard to separate the two. So having an access to this quickly so we can help the people more efficiently, more quickly is really, really important.
In a statement, Shared Health said the rollout of Manitoba MHA Connect is a multi-year project starting with programming for youth under 18. It's set to expand to adults as the year goes on and is aimed at reducing service redirection, establishing clear pathways, and improving Manitobans' experience as they seek help for their mental health and addictions concerns. However, the opposition PCs say if a program that will save lives is planned and ready, it should be rolled out at once and not in pieces.
This government seems to be wanting to make announcements, but there's no backup behind it.
Pointing to the 72-hour detention center and supervised consumption site, housing and addictions critic for the PCs, Jeff Becerra, says there's a pattern when it comes to the NDP's partial plans.
People of Winnipeg are losing confidence in this government because everything seems to be hidden. Everything seems to be handed out in bits and pieces.
In Winnipeg, Modjeski, City News.